Recently, I've noticed the coronavirus is everywhere, or at least news of it is. Being somewhat of a skeptic and a little bit paranoid, I set out to conduct my own back of the napkin or armchair analysis on the current coronavirus situation. Normally, these kinds of calculations have a far more complex statistical or epidemically based model, but I wondered if it would be possible to say anything useful at all based on existing publicly available information. Could you predict how many cases could happen, say, 30 days into the virus? I started Googling around, and so today I'll be sharing my findings. I started just by looking for any figures at all from a reputable source. I quickly found that the World Health Organization keeps its own up-to-date records in a nice dashboard about the emerging coronavirus situation. With this information, I was able to plot my information in a spreadsheet for two separate figures. The first being the number of cases, as well as the number of deaths. Yesterday, there were about 34,000 cumulative cases, as well as, sadly, 724 deaths. With this data in, I learned the simplest model which makes the most sense to use would be polynomial regression. Using it, I was able to come up with these two formulas to describe the current coronavirus data line of best fit and produce these two charts which represent the data. I then used my formula to predict the situation 30 days from now, and my results were, well, interesting. I just wanted to include a huge caveat before I share my findings, which is that this is a back of the napkin calculation. Please don't take it as anything even close to accurate. In fact, you should even treat my findings as fictional. You really should go by whatever the World Health Organization says. They'll use an actual specialized epidemic-based model created by experts, which accounts for various factors including how the disease might spread from person to person. This is the cumulative number of cases I'm sharing. However, the vast majority are not severe cases, which is a promising fact to keep in mind. These numbers do not account for the spread of the disease in different countries, as well as the effects of quarantine, public awareness, and modern public health knowledge. The numbers might actually be different depending upon what was shared from the Chinese government. And I'm also just going to mention that I'm personally optimistic about the whole coronavirus situation in general. I think it will be contained and we'll find a solution shortly. With all of that said, my very rough calculations tell me if the spread of the disease continues by day 30 or by Thursday, February 20th, 2020, the world will see 111,823 cases and also 2,228 deaths cumulatively. Although it's dangerous and reckless to say, since our model will likely be completely wrong over time, we can still further project and extrapolate the following results on a 60, 100, or even 1,000 day period. Like I mentioned, please don't go by what this primitive model says. I don't think it will get this bad, and you should continue to follow health best practices and news from the World Health Organization instead. Based on my simplistic model, I don't think the coronavirus is an immediate, complete shutdown or existential threat, but it's just something to keep in mind going forward. Even after 1,000 days or approximately 3 years, its numbers aren't showing to be as high as I thought they would. The virus would need to spread faster or spread on a longer term to reach, say, historic Black Plague level records and that level of impact on the global population at large. If you're interested in seeing the spreadsheet and data yourself, you can find the link to it in the description below. In fact, I view this as version 1. It's a very simple model for the coronavirus situation. I encourage other people to come up with a more sophisticated model or perhaps connect with experts and share their findings. That's all for today. If you're interested in following more of my work, please consider liking this video and of course subscribing below. Thanks for watching.